Hi everyone, my name is Tay and my case study presentation will be on oral and cognitive rehabilitation. Okay, so the case study is on Miss T. Miss T is a client that I have who is receiving therapy for adult speech, oral, and cognitive rehabilitation. Miss T was diagnosed at birth with bilateral sensory neural hearing loss. Currently, she has a cochlear implant in the right ear, and up until about 6 years ago, she has used ASL as her main mode of communication. She has trouble processing auditory information, different aspects of language as observed in phonological awareness, impairment or weakness, I should say, some reading comprehension difficulties, as well as functional math skills. Okay, so just a very brief overview of the neurology and neuropathology of hearing loss. So, with sensory neural hearing loss, there seems to be a blockage of electrical stimulus being transported from the hair cells, which are the main sensory structures of the auditory system, and so none of that auditory information can travel up to the brain via the cranial nerve number 8, the vestibulocochlear nerve, and this is my left side, yes. So without that input, this basically Miss T's Heschel's gyrus, which is the primary auditory cortex, is dormant for most of her life, and our job as therapists for aural rehab is to provide stimulus for her to process it, store it, and use it for a lot of her functional daily tasks. Okay, so besides the hearing evaluation, most of the things that we work on can be determined via assessment of cognition. So I'll talk about 3 different aspects of cognition that I think is relevant to working with Miss T. One of them is attention. You have to have their attention for them to receive and process information. Also memory and executive function. And so let's take a look at our Brookshire textbook, page 137, which has a nice outline of different assessment tools for attention. And so specifically selective attention. And selective attention is being able to discern what's important and what's not. So here is a tool that you can use. The question asked the client to cross out all the stars. So the stars is the important stimulus, and everything else you don't care about, basically. And then there is this assessment tool. It's called the symbol digit modality test, and that's being able to put 2 different symbols together, and then matching them accordingly. So with patients who have hearing loss, being when they have I just can't talk right now. When they have cochlear implants, there's just a lot of auditory input, and a lot of what they have to be able to do is throw out the ones that are not important and pay attention to, or selectively pay attention to what's important. Okay? For memory assessments, there is the Knox Cube test. For that one, the patient just repeats after the clinician tap out the sequence, like which blocks comes first, and it gets longer eventually. Or there is also the word retention test, and that's on page, both of these are on page 146. So basically, that's being able to recall as many words as you can after being read 15 words. And then another interesting test that I thought would be good to assess Miss T is this one. So one of the things that I noticed while working with her is that she would blurt out the wrong answer even though she knows what the right answer is. And I think a lot of that is just being fixated on a certain response, or like persevering is what this test is called. So the patient is asked to alternate different patterns like this, but if somebody has trouble with switching tasks, they will draw like, they won't be able to alternate the shapes, and that's on page 154. Okay, and the rationale behind doing these different assessments is that first you have to have arousal, you have to have alertness, and then you have to have attention. And after attention, then that stimulus can be stored in your brain as memory, and then with memory, being able to organize that information and using it to apply to solving problems, reasoning, making judgments, etc. So that's the hierarchy of cognition. Okay, so we have quite a bit of goals and objectives, and Miss T is working really hard. So I'll talk about two things that we're working on. So we're working on her being able to match auditory information to graphemes. So this deals with improving her writing and reading abilities. And currently we're using the Linda Mood Lips program, which has really nice pictures of the different consonants. And so with this, I have her match auditory presented phonemes and match that to the pictures, and then removing the pictures, is she able to match the auditory presenting phonemes to the grapheme, so the letter itself. And then another goal under that category is having her describe the different consonants by place, manner, and voicing. And then for functional math skills goal is her being able to memorize the multiplication of 5, 10s, 20s, because those are the amounts that bills come in. So having that foundation, building on her memory skills so that she can perform, different tasks when she goes to the store, or use the ATM. So that's what we're working on. Okay, so for therapy approaches and techniques, I use very visual stimulus, but usually keep it pretty simple. So instead of using like counting tokens when you're doing the multiplication task, that's just too much. That's like verbal visual and tactiles. I think it's overwhelming. So lately we've been using color flashcards, and I write the number on there so that she can count the cards by 2, 4, 6, 8, and then if she gets stuck on 10, then she can flip the card over and look and keep it very short and clear. So that's why I write the number on the cards. And I use a lot of visual stimulus because with someone who has used somebody who has used American Sign Language, which is a very visual mode of communication. I want to build on that strength that she already has to meet her goals, her current goals. And that all goes back to the rationale that we learned in class, the concept of cards. So for complexity, shorter responses and shorter types of stimulus is very good. The amount, the amount of what's being asked of her, and the amount of goals that we're working for that day. We want to keep it just right, so we work about 2 objectives per session, and I give her plenty of time to get her responses, and immediately after a correct response, then it's a verbal praise or like a tap on the shoulder, like, hey, good job, that was great. And then lastly, duration. I know that if I go past 10 minutes for a task, then she starts to yawn and get tired. So I keep it under 10 minutes or 10 minutes, and switch up the stimulus, and she seems to really benefit from that. So that's my client and what we're working on. I hope this has been useful and that you've learned something. Okay, thank you.